You're good.
We'll call the Health Services Committee meeting to order. And I have a motion to accept the minutes for the previous meeting. Supervisor Runyon, Supervisor Wild, all in favor?
Aye.
Opposed? Okay, anybody from the floor or the public or a supervisor have any comments before we start? Seeing none, Dee, you're up.
Try to make it fast for you.
Oh, take your time, please. I like things explained thoroughly.
All right. So the first two items, if it's okay, I'll kind of present them together. Our current contractor for our ISIP, Expanded In-Home Services for the Elderly, and our Title III program, which is Family Caregivers, in Warren County, Greater Adirondack Home Aids is going to be closing. So we are looking to enter into a contract with Fort Hudson to basically replace those services. The contract amounts will remain the same, the cost share, or not the cost share, but the county reimbursement will remain the same. The only thing that is different is the hourly wage will be $41 an hour.
Okay, can I have a motion to bring this to the floor? Supervisor
Both.
Runyon, second Supervisor Wild. Any questions?
What was the previous hourly rate if it wasn't 41 before?
With Greater Adirondack Home Aids, it was $31 an hour.
And why are they closing? Just,
I don't know all the specifics. I just know that they're going to be closing.
that's too bad.
Yep. Mhm.
Okay, any other questions?
Yeah,
Yes, go ahead.
we know why it went up $10.
It's a different provider and Fort Hudson is more competitive. Greater Adirondack Home Aids was kind of charging us less than what they really should have been probably.
Okay.
Thank you, they went under. Yeah,
What is the service that they provide for the $41 an hour?
so it's personal care services, so they can be doing either hands-on care like bathing and dressing. They can also be doing like chore services like laundry, vacuuming, things of that nature.
Thank you.
Okay, any other questions? Okay, call the question. All in favor?
Aye.
Opposed? Okay,
All right, and then item number 3 is permission to amend the contract with Countryside Adult Home to increase our cost per meal rate to $5.75 from $5.50, and increase the do not exceed amount to $180,000. And this is just because of the increased cost of foods and supplies.
okay, motion to bring that to the floor. Supervisor Runyon, second. Supervisor Thomas, any questions?
Is this budgeted?
Yeah.
Yes.
Okay.
Mhm.
Well, up to the 180.
So we're just increasing the,
Cost per meal reimbursement.
thank you.
Did you see the email that was sent about costs that we pay compared to what we'd be paying if we had to buy through the,
Hmm.
it was quite, we're 50% lower. It was very nice comparison to use. So, you know, it isn't that we're not shopping around. We are doing a pretty good job at keeping our costs low. So,
Good.
That was the analysis where Dee put together all of the amount for food that we're buying from distributors, and yeah, I remember that. Thank you.
Yeah, and with Countryside, we just basically reimburse them what it costs them to do the food for us, or to do the meals for us.
Thank you.
okay, any other questions? Okay, all in favor?
Aye.
Opposed? That's it. You have some.
I just have
items?
3 items I wanted to bring up, make sure I got the right number of fingers. Our senior fall festival is going to be September 25th at the Fish Hatchery in Warrensburg. It's $5 a ticket. We have tons of vendors there, but we usually have about 250 seniors that come, which is great. I will be sending out the invite to all of the supervisors shortly. The other item I wanted, or the second item I wanted to mention was that we are in need of volunteer drivers to deliver meals to our Warrensburg people. The individual that was doing one of the routes is temporarily out. So we really need somebody. If anybody knows someone, just send them to our office. And we do reimburse mileage for that.
Have you ever talked to Don about putting that out on our Facebook stuff? And
He has done it in the past, and usually whenever we post it on our page, he will share it on the county page. And then the last item, I just wanted to make everybody aware that we do have our farmers market coupons. We finally received them. These are $5 coupons that seniors can use at the farmers markets on fresh produce. You have to be 60 or over, and then your income, it has to be under $2,413 a month. for a single person.
2,000.
2,413. We do not double check the income. We don't verify that. We don't have to, so just so you know that. So if somebody's close.
And where do they get these?
They come to our office to get them, or we have several outreach events that we have scheduled. We started last week doing them. And that is on our page, our Facebook page as well, the outreach events.
Supervisor Runyon?
How does a vendor at a farmer market be eligible to accept the coupons?
So they have to reach out to the New York State Department of Agriculture and Markets to become a vendor.
Each vendor has. to-
Each vendor does, yes, yep.
Thanks. That was a question that came up.
Hey, any other questions? Any other thoughts? Oh, sure. Please do. No?
As a follow-up to,
Oh, yeah, I was just gonna do privilege of the floor.
yeah.
Yeah, you can do it now, because I call him privilege of the floor again.
Thank you, Chairman. In response, and as follow-up to Supervisor Running's question, at the Glens Falls Farmers Market, vendors that accept the particular coupons, and it's the same thing for the coupons that the Veteran Services provides, as well as the WIC program provides. They'll have a little sign that says that they accept it. Unfortunately, I guess for town of Thurman, providers, suppliers of maple syrup, honey, certain types of items, aren't part of the list of, but vegetables, fruit, meats, baked goods, I think are all on that list. And not all farmers markets, do accept, so check with your local farmers market, to see if they do accept that.
Supervisor Runyon?
If a person who's a vendor at a farmer market goes in, do they automatically get approved for all three of, the senior and
Yeah,
The
it's under
veterans.
the same program.
it's all one? So once they are approved, they can handle all three types of coupons?
Yeah,
Okay, thanks.
as well as individuals who receive SNAP benefits during the course of the year too.
And then what do they do? Collect the coupons and they get reimbursed?
Yeah,
Okay,
it's a
Thank-
little bit of paperwork for the vendors, but they like it because
yeah,
they feel good about expanding their customer base. And also they do well with it for a lot of the people who are on low and fixed incomes.
thank you.
Okay, anything else for D? All right, thank you, D.
All right, thank you.
Mr. York, you're next.
Morning.
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 All right, first item I have is a request to approve new contracts for opioid settlement fund proposals. Warren County has received opioid settlement funds and projects were solicited by the Community Services Board. We received 12 proposals. The request came in at 1.6 million. And we only have a little shy of 1 million to distribute. So the Community Services Board set up an ad hoc committee that's been reviewing the proposals. We're going to have to, we asked for a 1 to 3 year span for the proposals. So some people did put in for 3 years, so we're probably gonna have to, not gonna be able to fund everybody fully for what they requested, basically. But we did get through some of the proposals. And so we wanted to go ahead and push those forward. The request is for contracts for 340,000. There's a table, Schedule A attached. It shows the four of the 5 projects that we would like to advance. The 5th project, I'll talk about in the discussion items there. It's for the sheriff's office.
Okay, can I have a motion to bring this to the floor? Supervisor Wild, Supervisor Runyon, any questions? Okay, seeing none, all in favor,
Aye.
Hi.
opposed? Okay. 2.
Right, number two, request to amend the 2025 Warren County budget to accept $7,280 from New York State Oasis. This is 100% state aid that is designated for the pay for the cost of the purchase of naltrexone and buprenorphine for individuals with substance use disorder that are incarcerated in the county correctional facility.
Okay, motion to bring this to the floor. Supervisor Runyon, Supervisor Wild, any questions? Supervisor Patchit?
Thank you, Mr. Chair. So is this am I just understanding this right? We get a grant from the state that comes twice a year to give incarcerated individuals medication to satisfy their drug needs?
Well, what it is this is new money. We're getting it, they made it effective July 1, so that's why there you see the two different amounts there. So going forward, it'll be 14,000 a year, for annual funding. But it is only for a 2-year period at this point. But it's to pay for medications to treat opioid use disorder.
Yes, I understand that, but my question is more further pointed at. We are essentially accepting that people have opioid addictions that are incarcerated, and that the state is taking the position that we diagnose this person and then we essentially give them medication so that they can be stable while they're incarcerated?
Right.
Okay, thank you.
And counties are already paying for this, so this is to offset the county's costs.
Isn't it also to help wean them off of it too?
Yeah.
Yeah.
What is the reality if you don't have a program like this and you just say, well, you're incarcerated and the fact that you have a opioid addiction is irrelevant? So we're essentially, as a state or in the county, spending money on people that have addictions, which is somewhat through their own fault. And what is the reality of what happens to that individual if we do nothing?
Well, the sheriff's office has a contract with Prime Care to provide medical and substance use services in jail. So it would be the same, we're already they're paying for the contract. The services are being delivered. I think, Prime Care, if they were to identify a medical issue and not treat it, they just wouldn't do that, when they identify substance use disorders, they offer the appropriate treatment. Just like ethically, right?
This is chaos also, I would imagine.
Saying it's unethical to not treat somebody that has an opioid addiction?
I would say if they identified, medical issues and chose not to treat them, that could be questioned.
Get that? I guess it's like, where does it stop though? Like, people get medical marijuana cards nowadays. So all of a sudden somebody has a medical marijuana card and they're incarcerated, and now all of a sudden we're providing marijuana to that person while they're incarcerated. Couldn't you make that same point? So I don't necessarily agree with the thought process, but I understand why we're doing it. Thank you.
Supervisor Runyon?
I think the point is that if they're in need of this, for them to go without and go through withdrawal would be a lot worse than to help them ease out of it with this. And as far as medical marijuana, you don't have that same type of withdrawal that you would with this, and you do not need to have incarcerated individuals going through withdrawal without any help.
Supervisor Wild?
I was just gonna offer moving 2 and 3 together because they're related.
I have no issue with that.
Yeah, it's the same money.
Everyone okay with that?
Mm-hmm.
Okay, well. Bring that as a motion, then we move both 2 and 3 together.
Okay, I'll move it.
Supervisor Runyon, Supervisor Bruno. Okay, any other questions? Okay, all those in favor, signify by saying aye.
Aye.
Opposed? Okay. You had some discussion items too, Rob?
Yes, the discussion item was opioid related police training. So there was another project that the sheriff's office had put in for opioid settlement funds that are working with a group called Z School that does training for law enforcement specific to opioids and responding to overdoses and that sort of thing. So we also wanted to approve that project. They did vote to approve that. But we thought that that could be handled differently than the 4 contracts that we talked about. Since they are county office, county department, we thought there would be a way that they could draw down off the opioid funds through a budget amendment that they would bring forward.
So would that have to come from the sheriff's office?
Yes.
Okay,
So that's why I just listed it as a discussion item.
and Sheriff LaFar, he understands this?
Yes.
Okay.
Yep.
Anyone have any questions for Rob on that? Oh, well, I'm not the privilege of the floor yet, Ben.
When you do.
So we're very close. I hear the whip snapping. Okay, is that it, Rob? Okay, privilege of the floor, Supervisor
Thank you.
Driscoll.
My question is to Rob, would that training opportunity still be available to be afforded to the Glen Falls Police Department also?
Yes, I believe it was a collaboration between law enforcement agencies in Warren County.
Okay.
Yeah.
Okay, thank you.
Included both
Okay.
cases as well.
Right, yeah, thanks.
Okay, anybody else have any questions for Mr. York? Seeing none, thank you, Rob.
Thank you. Thank you, Rob.
In just a minute, we'll have Janelle get in here. But I agree with what you said. You know, where does it stop?
Thank you.
Really, well, I can tell you worse things later. Social services. Used to pay to take people to Albany. Well, good morning, ladies.
Does anybody need a packet?
It's always nice to see you.
Got one? Anybody need a packet now? Okay, oh, hold on.
Thank you. Wow, this is.
Sure.
Oops.
Are you ready yet?
Thank you.
It's good stuff. There always is. Okay, Janelle, the floor is yours.
Thank you. So the first resolution request we have is to accept the 2024 Health Services Annual Report. Each year, Health Services prepares an annual report to document our programs and trends. This report also reflects the dedicated and amazing efforts of our entire health services staff, as well as the contractors that ensure all these services are available to promote the health and safety to the community. I would like to recognize and thank the staff for their passion and dedication in all their respective programs.
Okay, can I have a motion to bring this to the floor? Supervisor Rundon, Supervisor Thomas. Any questions?
Sit down.
No questions? I'll call the question. All in favor?
Aye.
Opposed? Okay, number 2.
The second resolution request is requesting to amend our budget to reflect the anticipated Jules settlement funding. We've done a lot of work with this and we're hoping to get the money soon, but it seems like we have to make a little change in our budget. So I'm going to turn it over to Tom.
This is just to, actually, it looks a little different because it's reducing our budget. Our budget, we put the full amount of the grant that, or it's not a grant, it's a settlement. That's the, over 300,000, 381, 885.14 to be exact. We put the whole thing in there not knowing if we were gonna get it all, but just recently in June, I believe we had a phone call. They didn't give us anything in 24. Now they're catching up, giving us 3 payments. We're expecting, and I've notified the treasurer's office to keep an eye out for it if it comes for 143,206.92. So I want to reflect the budget to just record that amount. And then every year we've been told we're going to get $47,735.64 every June 1st. So we will put that in the budget just for that amount. If there's any funds that we didn't use, which at this point, it's not much left in the year to spend all that, but we'll see. We will carry that over and do an amendment next year to just bring it up so that it's current. But at this point, this is what we're expecting and we're waiting for this money any day now.
Okay, motion, bring this to the floor. Supervisor Rundon, second. Supervisor Thomas, any questions? I have one question. I thought at one point in time, we didn't add anything in until we had the money in our hands. So I didn't know if we could do anticipated like this.
Aren't we subtracting?
I'm subtracting it, but all I'm putting in there is
Don't
what,
have the money in our hands. At
no,
the
it
time.
goes into a deferred account.
Yeah.
And then when we get the funds, that's what it's gonna do. It's gonna go into the deferred account and
I
then.
understand that part, but I was looking for clarification because I thought at one point in time, we said until we have the money, we don't do anything in the budget.
I think typically if we've received a letter from the state telling us what we're getting or what we're not, like with other grants, we've usually brought it up, but we'll do whatever.
No, that's fine. I remember at one meeting that's what we had said, that until, and maybe it was one of the department heads that said that too, that until they have the money in their hand, we don't like to put it in or out of the budget until that. So I have no problem with this, but just for clarity for myself.
Mhm.
Any other questions? Okay, motion to approve? All in favor? Opposed? Okay. Discussion items?
Do your
Um,
attachments.
Attachment 3 and 4 are our expenses and revenues. Attachment 3, regarding salaries at this point, year to date for the end of June, we're at 44.78% of the budget. And last year at this time, we were at 48.36%. So we're doing better this year. On our comparison on attachment 4, so you can see the difference between each categories. You'll see the equipment right now is showing all of our infrastructure grant that we've gotten phase 1 so far. Also, one of the vehicles that we've gotten so far for this year are reflected in equipment compared to, and I also mentioned child passenger car seat grant. We did buy some car seats, so that's in there too. Contractual expenses are a little bit below last year at this time, but again, it's due to timing of invoices. And now that we're at the end of the school year, we're just waiting for all of those. Employee benefits, again, is above with obviously salary increases. We've got increases in retirement and taxes, so that's gone up. And revenues, we are waiting to finish, the quarterly grants will be this, and also closing our month in June for the home care. So those aren't reflected yet.
So these numbers were to May, right?
These numbers were till July 7th, actually till the end of
Okay.
July 9th.
Here for May.
Well, May,
Yeah, it says they're accrued above in revenue and is May for home care.
oh, right, May for home care. We're working on
Oh,
June.
okay.
We haven't closed June yet, but yes, May is closed
That
in
number,
here.
yeah, okay, I
Yeah.
understand. Anything else, Ton?
Nope, that's all I've got.
You know,
So for informational items and reports, we have our typical attachments. For status of referrals, I just thought I would point out that we were visited by the state. We had our state survey June 23rd through 26th. Overall, it was an excellent survey. Surveyors told us that in addition to the state people that provide the oversight. From the visits and the care that we provide, they commented that our nurses were exceptional. We received no deficiencies for the hands-on care that we provided. They had to look hard. They had to look into our policies and procedures. You might remember the last time that they came, they were looking at all the what if policies that we had to put in play. They've had their opportunities to review all those way back when they came for the last corrective action plan. But this year, the theme was more you need to add this to your policy. So we were cited for some policy and procedure things. There were minor tweaks, didn't really affect the care. They looked through personnel records. We've had a staff member that was here for well over 20 years that they've seen the chart over and over and over, but because the MMR certificate wasn't signed by a provider, they told us we couldn't count that. So there were some little things like that that we have to go back and fix. But all in all, it was a great survey. The other reports, for the rabies, I included our rabies clinic schedule, just so that you'd be aware when the next clinic is. And then for the Governor's Traffic Safety Committee, I put in the handout with regard to our upcoming events, for the child safety seats. One of them is August 26th in Chestertown, and then on August 27th, we'll be in Warrensburg to offer those services. We've already offered a few down Queensbury, Glens Falls area, so now we're hitting the North Country. And with that, I'm available for any questions.
Do we put this stuff on the webpage too?
Yeah.
Did Don put that so that the public is aware of it?
Yes.
And I'm not surprised. You always do a great job. You and your staff are above most expectations anybody could have. And my only other question is, how close is the office of being finished?
We have finished phase 2 and we're getting ready to start phase 3. Phase 3 has a little bit of construction and getting rid of 2 doorways and creating one and moving a door. Besides that, the furniture has been ordered and is already kind of here with the exception of a few items on back order. But we're gonna wait for the carpet, the painting, and the few renovations before that happens. But we're close.
Well, and you're all,
Train is going down the hill.
yeah, well, and you're all working in pretty tough conditions with the construction going on at the same time, so it's not easy, but appreciate your patience. Any other questions? Anyone from the public have anything that they would like to ask? Seeing none, can I have a motion to adjourn?
So moved.
Supervisor Patchit, Supervisor Wild, all in favor?
Uh,
Opposed?